Medicare expenditures, there is tremendous increase in the Medicare expenditures, about 13%. Why is this increasing? They just blame it on the doctors, technology, and everything. That is not just it. There are people demanding more services, and it is easy to get Social Security now. Once you get the Social Security, you go on to Medicare or Medicaid, one of the two. They showed in Puerto Rico is not the largest state. It is not even a state, but U.S. Social Security system pays for Puerto Rico. You all know that, right? Now, 3 zip codes with highest Social Security approvals and recipients, 3 out of 10 zip codes in the entire United States plus Puerto Rico are located in Puerto Rico. 3 zip codes with the highest percentage of them. So Medicare expenditures will be much higher in Puerto Rico than in Tennessee. So that is what is happening. We really can't get hold of these issues neither with the Obama plan nor with the Paul Ryan's plan. Neither one is going to control that. There should be more basic controls. Most people are currently insured. When this was published, there were 46 million uninsured. Now it is 52 million because of the increasing unemployment. But highest insurer is your Medicare, followed by Medicaid. In that year, I will just show you in a few minutes how it is dynamically changing. Costs are increasing. Now in 1999, it was $5,000 for family and about $1,500 or $1,600 for individual. In 2009, this is the national average, $3,515 per family, per one person, and total per family is $13,000. But this is not the same. In Massachusetts, it is $26,000. In Kentucky, it is for me, it is $17,000 per family. So there is significant increase in these things. Most of the money was coming from private insurances, like 52% or so, but it is increasing now. Public funding was, in this picture, it is 48%. And where does it go? Large amounts go to the hospitals. And physicians and clinics is about 22%. Out of that, overall 18% goes to the physicians. But if you take only Medicare, it is only 14% goes to physicians. Premiums are going up, but wages are not as much. So they are saying that if you just reduce the growth by 1.5%, you can save more than $2 trillion. I don't think that is true, but at least that is what the documents say. The monthly benefits, these statistics are really, really skewed. If you ask any patient you see, they say that their out-of-pocket expenses are increasing, but statistics show that it is not true. They're not as increasing as much as everything else. Social Security benefits, these are medical expenses, and these are out-of-pocket expenses. They are increasing, but not as much as the others. So this is just for Medicare itself. This just came out like 3 days ago or something out of press from MedPAC. The money they receive is 37% comes from general fund. This is where our deficit comes from. The payroll taxes contribute to only 33%. These are the patient contributions. Everybody has to pay their own premiums, 23%. And 7% from other sources. So this is the stuff they are trying to cut. That is what they are trying to save. Like when they keep saying that they want to cut this budget, I have a slide, but it takes 2 minutes to show that. So I don't know. You can take all the coins and put them in this table, and divide them, that will be this much of a piece they are trying to cut from this whole table. From that, if you take it exactly what they want to cut, there are like 500 coins in that place. Half a coin, that's all. It is so little that is not going to make any significant difference. Now, where does the money go? 27% goes to the hospitals, 22% to Medicare plans. You see, Democrats want to protect the hospitals. Republicans want to protect Medicare Advantage plans, which I call disadvantage plans. They are a disadvantage for everyone. They are advantage for themselves, of course. Physician services only 13%. But prescription drug benefits are 12%. And Medicare Modernization Act, we sometimes tend to blame mostly the Democrats for this healthcare debacle, and some left-wing nuts, right-wing nuts, they blame Republicans and Democrats, all these issues. But this plan was started by George Bush, Prescription Drug Benefit Plan, MMA. That was the initiation of destruction of Republican Party. That is how they lost their House and White House and everything, and now they are trying to gain back. Outpatient hospital, that is ambulatory surgery centers, everything else is 6%. Skilled nursing homes and home health, other Part B covered services. So regulations are the ones which are killing us. If you sit down and look at it, you are spending so much money on these stupid regulations, and if you don't spend money, you are going to go to jail, or something else is going to happen. They said there are $1 trillion wasted in medical care per year. Cost of regulations without any benefit in 1994 was $169 billion. So in today's dollars, it is a lot higher. Unfunded mandates, this is what is really bothering everyone. Compliance programs. If you contact some high-powered attorney, they are going to tell you it is going to cost you $60,000 to $100,000 to start up. Then annual maintenance. Compliance means there are several programs. There is one for HIPAA. In HIPAA, there are 2 or 3 programs. Then you have an OIG compliance plan, OSHA compliance plan. Crazy. Annual maintenance, if you really want to get it updated and everything, it will cost you $30,000. Now, ICD-10 is coming. Nobody knows why the hell do we really need ICD-10. They say they can collect the data better. Yesterday, there was a news release from Institute of Medicine. They conducted a study about the medical mistakes. All this time, we were thinking that medical mistakes were significantly contributing. But this new study says, using AHRQ criteria, and there is another criteria using, the medical mistakes are 100% more. It is not 5%, 10%, 100%. So they found, utilizing AHRQ criteria, about 3 or 3.9 mistakes or so in this study. But when they expanded, utilizing this other criteria, it was 359 mistakes. So 100% increase in the mistakes. So if we go according to this criteria, somebody creates some criteria, and it is like 100% of the people need urine drug testing confirmed. They need to come to you every week. Or I'm exaggerating a little bit, but there are doctors who are recommending that they should be tested every 4 weeks. So the same thing happens. We really don't know if these mistakes are really serious or just somebody, a nurse may forget to enter something. That could be considered as a mistake. Or they may have put it in a wrong box. With the computerized system, those things can happen. So that can be considered as a mistake. So 100% increase, so that is really 100 times, I mean, not percent. That really blows my mind off. And they are saying this AHRQ, where we are spending hundreds of millions of dollars with upcoming PCORI, patient-centered outcomes research. They call it in Congress PCORI. I just found out last week. So that coming, and $1.1 billion Obama put from the stimulus plan, it was just proved by IOM itself that these are all irrelevant stuff. So insurance in the ICD-10, it is going to cost each physician $25,000 to $30,000 to implement, and it's not going to save a single life. It is like another Y2K. You need to have single-dose vials that increases your practice expenses, separate waiting room in a surgery center. Just for insurance interaction totals, we spend $30 billion in the country. If they can standardize these things, if they don't give you all this hassle, you can save all that money. That translates into $88,000 per physician. So that is the gross income of some of the doctors, actually. If you are managing your prescriptions, overall it costs $16,000, but in our settings, probably it costs us $30,000 per physician just to manage these prescriptions. And if you are nice enough and start getting their pre-approvals for each insurance company and everything, it is going to cost you even more. EMRs are very underfunded, but they are going to be mandated. Fraud and abuse, we have RACs and OIG, of course, lots of things. But there is also a problem on our side. On our side means not exactly our side, but in interventional pain management. Now we saw that Medicare was increasing 13% per year. During the same period, interventional pain management techniques have increased 23% a year, 23.4%. What is interesting is 25% of these are performed by non-trained folks, whether it is physicians, nurse practitioners, somebody who is not trained or not qualified. If they can remove this 25%, it will be beautiful. We don't have to have this increase in there, and we can survive very nicely. Now, 3 zip codes with highest Social Security approvals and recipients, 3 out of 10 zip codes in the entire United States plus Puerto Rico are located in Puerto Rico. 3 zip codes with the highest percentage of them. So Medicare expenditures will be much higher in Puerto Rico than in Tennessee. So that is what is happening. We really can't get hold of these issues neither with the Obama plan nor with the Paul Ryan's plan. Neither one is going to control that. There should be more basic controls. Medicare expenditures, there is tremendous increase in the Medicare expenditures, about 13%. Why is this increasing? They just blame it on the doctors, technology, and everything. That is not just it. There are people demanding more services, and it is easy to get Social Security now. Once you get the Social Security, you go on to Medicare or Medicaid, one of the two. They showed in Puerto Rico is not the largest state. It is not even a state, but U.S. Social Security system pays for Puerto Rico. You all know that, right? Now, most people are currently insured. When this was published, there were 46 million uninsured. Now it is 52 million because of the increasing unemployment. But highest insurer is your Medicare, followed by Medicaid. In that year, I will just show you in a few minutes how it is